What is a retroverted uterus and how does it affect conception?
Hello and welcome to our informative discussion about a topic that might not be well known, but is incredibly important for many women, the retroverted uterus. Also referred to as a tipped or tilted uterus, this condition affects up to a third of all women. But how does it affect conception? Let's dive in to find out.
What is a retroverted uterus?
A retroverted uterus is a condition where the uterus, instead of leaning forward towards the belly, leans backward towards the spine. It's also known as a tilted or tipped uterus. The medical community considers this a normal anatomical variant, much like having left-handedness, and it generally doesn't cause any health issues. In most women, the uterus leans forward, towards the stomach. But for about 20% to 30% of women, the uterus leans backwards. It's also important to note that the position of the uterus can change after childbirth or during menopause due to changes in the body.
How does a retroverted uterus affect conception?
Now, let's address the question that's probably been on your mind. Does a retroverted uterus affect conception? It's a common misconception that having a retroverted uterus can make it more difficult to conceive. In fact, most studies show that the position of the uterus does not significantly affect a woman's ability to become pregnant. However, there are some conditions related to a retroverted uterus that might influence fertility indirectly. For instance, endometriosis and pelvic inflammatory disease, which can sometimes cause the uterus to become retroverted, might also cause fertility problems.
How is a retroverted uterus diagnosed and managed?
A retroverted uterus is often diagnosed during a routine pelvic exam. If the uterus position is causing symptoms like pain or discomfort during intercourse, a doctor may recommend certain exercises or interventions to manage these symptoms. As for its impact on conception, again, a retroverted uterus by itself does not typically affect a woman's ability to conceive. If you have a retroverted uterus and are having trouble getting pregnant, it's likely due to other factors, and you should consult with a healthcare provider or fertility specialist. So, that's a brief overview of what a retroverted uterus is and how it may or may not impact conception. As we've seen, it's a common and typically harmless condition. Remember, if you're experiencing any issues with conception, it's always best to consult with a healthcare provider to explore all potential factors. Thank you for tuning in, and we hope you found this information helpful.